Mr. Jon Gordon, pleasure to have you on the podcast. Really grateful to get to converse and speak to CrowdHealth. We were just talking offline about your experience at adopting Bitcoin in El Salvador. And I've listened to Andy Schoonover, I believe is his...
Yeah, Schoonover.
Schoonover, okay, almost. I've seen him speak on Saifedean's podcasts. Marty, he was on Jose's. And I was really intrigued to hear about this new model that you guys have that's empowering a lot of Bitcoiners. And just, I would think people that understand the healthcare system and our food industry, they can take a look at this and not even be a Bitcoiner, but still understand that there's some kind of, new way to break away from our current system and in a manner that helps them get more value from what they're contributing to. And so really pumped to talk about CrowdHealth. And I'm pretty convinced already that I'm going to become a member soon.
Awesome. Well, that was easy. Thanks so much for having me on the show. I appreciate it, Jon.
Yeah, it's number 3. Really excited to continue the momentum of this. We were just talking about you almost not making it to El Salvador to present CrowdHealth at adopting Bitcoin.
Yeah, we had a delay. You get on the plane, got an engineering issue, get off the plane. So we were going to miss our connection. I still wanted to make it down there and missed the connection in Dallas by 2 minutes. They closed the gate. They're still sitting there, won't let me on. So went to Miami, spent a night there, got on the second flight out the next day. So luckily was able to make it down in the afternoon for day one of the conference, but knew that I'd gone last year to adopting Bitcoin more on my own accord and wanted to experience Bitcoin country for myself and being able to come back and share my thoughts and really our business at CrowdHealth was an awesome opportunity, and being able to interact with different Bitcoiners from all over the world that are building circular economies on Bitcoin. And you're seeing Bitcoin move more from just this store of value asset into medium of exchange and really being a more efficient use and from the network aspect and facilitating transactions in any industry, including in healthcare.
Yeah, and the guy that you got a ride from, was it directly out of the airport too?
Yeah. Shout out to Jeremy. He picked me up and
Bitcoin driver.
Paid him in Bitcoin, paid the entry fee into the country. They even took a video of me while I was paying in Bitcoin. They were excited about that. They were still using Chivo wallet, so it was actually an on-chain transaction, which was interesting. But most of the country and Bitcoin Beach wallet is using Lightning transactions and getting those fees down basically to zero. So being able to spend a lot of sats in El Salvador, I think I had around 20 Bitcoin transactions, super easy, everything from buying coconut on the beach to a hotel in El Zonte. Spending sats is really a lot of fun. It's so easy. And you just, El futuro está aquí, right? The future is El futuro. It's really here. The future is here, and getting to use Bitcoin in El Salvador feels like stepping into the future. And then coming back to the US and also, in healthcare, which is an industry that's been very resistant to change, seeing how much there is to go, it's inspiring for me.
Yeah, so let's jump right into it. I would love to just hear your background prior to joining CrowdHealth, and why you're so passionate about improving our healthcare system.
Absolutely. So my background is working in healthcare. I got a fiat economics degree. They don't touch on economics, and even was pre-med before that. Got weeded out by that system and realized that wasn't the path for me, but was always very interested in healthcare and biology and understanding the body and improving the health of individuals. Got into healthcare consulting, was helping hospitals and health systems with their strategic planning, everywhere from Bangor, Maine to Yakima, Washington, seeing different communities across the country. And interesting, and everywhere you go, everyone thinks they're really unique, but at the same time, you've got this national overarching healthcare system that while there's elements of market forces, there's really a lot of government involvement, and there's a lot of centralized forces that prevent really true consumerism in healthcare. So 3 years of working on different projects, looking at questions of, do we build another inpatient center, or do we invest in ambulatory surgery and primary care network for boosting our facility? Or how do we develop our ambulatory care network? What does it look like to build out an orthopedic strategic orthopedic service line, cardiovascular service line? So getting into really the procedure and disease-based level, I was at a company called SG2. We were really thinking into the future of healthcare and predicting a lot of the changes that you'd see in care, moving out of the hospital into lower cost settings, virtual care becoming a increasingly prevalent use, especially pre-COVID, but now after COVID, and during, being able to connect to providers with those tools as well, being a huge impact. And I wanted to learn more about the payer space. So even working and being in the C-suite with hospitals and health systems, from a strategic standpoint, the financials was even a whole nother ballgame. So I had an opportunity after traveling for a bit and taking some time to get into the payer space. So I worked at a big Blue Cross plan, working in Medicaid, which is insurance for low-income individuals. Over 85 million people are on Medicaid, which is actually regulated at the state level. So it looks different in each state. And what was interesting is the plan was actually losing hundreds of millions of dollars a year, but they didn't care so much because they were making a ton of money on the commercial plan. So the McDonald's and Boeings of the world, all the employer-based contracts were also running through this company, so that, yes, they wanted to try to make a profit on the government business, but the payment rates were so low, and in managing the care of those populations with all the churn going on can be very difficult, that they were losing a lot of money. But I had a chance to see what it looks like being inside an insurance plan, from the financial and projections, claims processing, all the operations, call center, all the things that go into running a health plan. But I saw a lot of the perverse incentives as well. So health insurance companies are only allowed to make a 15% profit. So for every $100 in premiums that they bring in, they have to pay out $85 in claims for their members. So the only way for their bottom line to grow, for top line prices and premiums to grow. So they're supposed to be your agent, negotiating with providers to get a better price. But underlying all of this system is increase in prices and premiums. So we've seen that over the last couple of decades, over 200% increase in premiums. After that, I worked in medical supplies and had an awesome experience getting to work on actually an innovative product. We were putting RFID chips in sponges that were used during surgery to prevent retained objects in the operating room. So a whole nother conversation, but that happens several thousand times a year in the US, and it costs the hospital $500,000 in reoperation and litigation costs if that happens. So being able to count and detect sponges in the operating theater is very difficult when you've got bloody sponges, hundreds of them oftentimes for some of the bigger surgeries that you're dealing with. And then over this time, I was working and getting a double master's in health economics and policy, studying other health systems around the world, comparing them to the US, and realizing that there are other options, right, for paying for healthcare, for receiving care, and there's trade-offs. Ultimately, risk is in the middle. You have the payer, the provider, and the consumer of healthcare, and different market failure that happens due to some of the perverse incentives of moral hazard, adverse selection, people oftentimes thinking they are covered. Oh, someone else is paying for it. I'm not going to think about what the price is, right? Or kind of wanting to dump that onto other people. So over this time then, and when COVID hit, I'd say, and getting married in 2020 and all the money printing started, I finally came around to Bitcoin and was understanding that there is another way, another monetary system that we can use that isn't fiat. And all of the healthcare and health insurance system in the US is very much based and built on fiat, where it's become a $4 trillion industry. 20% of the US GDP is spent on health every year.
Wow.
20%.
Wow.
It would be it's just mind-boggling the amount of spend, but a quarter of that's administrative, 25% admin, all the middlemen, and half of that is waste. And there's plenty of data and research out there to show just how much is going into waste. And a lot of the waste is because you have to deal with 10 different insurance providers at a single facility. So you see a massive growth in the number of administrators compared to actual physicians or providers. And you actually have a shortage of docs in a lot of areas. So a long-winded way to say I've really dove into healthcare and then came onto Bitcoin, understand we can, I was thinking on my own, how can we integrate Bitcoin into healthcare? And how can Bitcoin fix healthcare? Well, we can pay doctors directly in Bitcoin and save the 6 to 10% fee that's taken out of every transaction. And that's when I came across CrowdHealth and heard Andy on Marty and TFTC and Jimmy Song's podcast and thought, wow, this is brilliant. Right now we have a crowdfunding model. We're bringing back this legacy that humans have, the way we've operated for thousands of years in a community, helping each other when we got sick, negotiating directly with providers, going and introducing consumerism into healthcare, and then having Bitcoin as that savings piece to preserve our members' future purchasing power for healthcare services. So I really wanted, and after being in El Zonte last year at adopting Bitcoin and leaving Medline at the end of last year, kind of did some soul searching and traveling and some personal goals I wanted to accomplish and getting yoga teacher training in Bali and running a marathon in Jerusalem and wanting to focus on Bitcoin adoption, but also bring that into healthcare. So I was super grateful to have connected with Andy and had the opportunity to contribute to CrowdHealth this year, joining in June. So it's really been fun, and being down here in the Bitcoin Commons and getting to interact at the different conferences that have been going on in the Bitcoin space. It just feels right. It feels like people are building and growing and deciding to take their health into their own hands.
Mm-hmm. Yeah, that statistic of 20%, that's 20% of our GDP in the United States that goes to healthcare, and a good portion of it is waste. That is a daunting fact to hear. And I'm curious as to why is there an increase in administrators, and we're kind of shortening the amount of doctors that are working in the hospital system?
Yeah, there's a lot to unpack there, but I'd say at the core of it, you have people as consumers are removed from the actual spend of healthcare when you're covered by insurance, right? So half of the country is on employer-sponsored health insurance, and employers are paying actually $1 trillion a year. So individuals that are actually, instead of their wages increasing with productivity increases, a lot of that value has gone into health insurance premiums going up and being able to manage all of the middlemen in healthcare, whether you've got on the pharmacy side, pharmacy benefits managers, even on the medical supply side, you have group purchasing organizations, you have employer insurance brokers. There's all this spend there and kind of different entities coming in and taking a cut of every transaction. It's just more and more middlemen, and also being disconnected from your own body. In half of the states, you can't even order a lab test for yourself. You need a doctor's order. And then more and more centralizing forces in insurance, having to pre-contract and establish these networks, and then more M&A, mergers and acquisitions on the provider side. So you have more and more centralization.
Oh, man.
And providers are getting squeezed. So normally providers are getting paid 2 to 3 months after they render the service. And 18% of in-network claims for Obamacare plans or marketplace plans are denied. So then all of a sudden, those claims are denied and individuals are on the hook. And that's leading to massive debt. 1 in 3 Americans has medical debt, right? So, it's a few $100 billion a year.
On top of getting denied, your claim being denied, you've been paying these premiums and, on a monthly basis, right? And I mean, that's not cheap either. Some people are paying, I don't know what the average is on a monthly basis, but you're paying premiums, co-pays, which typically aren't too much, but the premiums are. And so if you're constantly paying for that, specifically for healthcare, and it's to my attention, it seems like dental and visual and mental are all separate insurance.
Yeah, those have traditionally been carve-outs from traditional insurance plans. And yeah, the employer is paying on average $8,000 a year in premiums for an individual, paying around 75 to 85% of the premium. So there is some employee cost sharing. And then for a family, it's $22,000 a year just for premiums. And then your deductible is probably going to be $5,000, $6,000, even up to $10,000, depending on the plan. So you're going to be spending as a family over $30,000 before the insurance even pays a dime, which is incredibly expensive, right? And then you have a certain set of docs you can or can't go to. And speaking to, also the admin or just the shortage of docs, then you've had more concentration in cities, and the incentives within the medical field in which specializations doctors choose is heavily incentivized, right? Follow the money, right? You look at dermatology or orthopedic surgery. This is where you have, some more of the compensation for doctors, less so from a family medicine or geriatrics, so that you have that selection within the health fields, medical licensure laws being very strict. So you have a shortage of docs in rural areas and other communities that really need providers due to incentives, fiat incentives.
Yeah, it's very interesting. I actually haven't, I'm sorry, Safety, and I haven't finished the fiat standard. I have read the Bitcoin standard, and I got past, I think, the medical system and academics, fiat academics. And it's interesting to see, even in academics, not to get off topic, but in academics, like Harvard has more admins than their own undergrads, body of students. It's just like this bureaucracy growing in so many different parts of our world, or at least American society.
Exactly.
And so it's really cool to see CrowdHealth eliminating that middleman. It's just you guys and the members that are in this kind of community, that are contributing to a subscription, right? A monthly subscription every single month.
Yeah, so it's very different than the traditional insurance model. So an individual up to 54 is paying $175 a month. 40 goes to CrowdHealth. That's our revenue. It's a subscription-based model to get access to all the tools and services that we provide. And then the other 135 you're saving in your crowdfund account each month. And that account is growing and is used to help pay for other people's medical expenses for crowdfunding. The member commitment is to pay the first $500 of a health event. So say someone has a torn ACL, all of the imaging, surgery, physical therapy needed to address that event is one health event. The member would be responsible to pay $500. And then let's say it's $5,000, we'll go to 100 people and say, hey, are you willing to contribute $45 to this person's knee surgery in Florida? You could say yes or no each time, so it is voluntary, but you get a generosity score based on your track record of giving. So now the incentive in the group is to be generous and give. And you also feel good about that, right? That's, we're bringing humanity back into healthcare in a way that is missing when we have all these middlemen, or we have an insurance that we're just paying into. And we even have members that are saying, can I give more to this event?
Yeah.
I really want to help this person.
I saw that.
Had a miscarriage, or have a really horrible injury. I want to help this person. So it's creating a system to, and really I think a parallel system to the current health insurance and current healthcare industry, but building a structure around even what GoFundMe has going on today, right? So GoFundMe, everyone's probably familiar with from a crowdfunding perspective. The top GoFundMe campaign are all medical bills. 1 in 3 GoFundMes are medical bills. $650 million a year being raised on GoFundMe, but only 12% of those campaigns are getting funded. You got to go public and ask your family and friends, and try to meet these needs. And oftentimes those people are getting screwed with bills that they shouldn't have gotten stuck with in the first place. So the other big piece of what CrowdHealth is doing in our team is negotiating directly with providers to get fair pricing. And it's a federal law that you can get a fair price for a healthcare service. So when you don't give up your agency to a health insurance company as self-pay, uninsured individual, we actually have a lot of leverage to work with providers so that what we're enabling is crowdfunding before the event so that our member has the money in their account to pay the provider directly on the day of the service. So now that provider doesn't have to wait 2 to 3 months to get paid, and they don't have to worry about chasing after debt, which hospitals are only getting 9 cents on the dollar for all the debt that they're chasing. So all of a sudden, by cutting out the middleman, just like with Bitcoin, you can cut out a bank. You don't need a bank to store your wealth. You don't need a bank to transact with another individual. You don't need health insurance to be healthy or to access healthcare or to even pay for a larger health event. And that's where the community comes in.
Yeah, there's a lot to unpack. There's a couple of questions that popped up. So for the first 3 to 4 months, you're just covering for that first 500, right? It's not your subscription, your fiat is technically not going into Bitcoin.
Yeah, so the Bitcoin piece of it is that the first 4 months you're paying fiat. And then after 4 months, 75% of your monthly contribution, less the subscription fee, goes into Bitcoin.
Gotcha.
And now you're stacking sats instead of paying health insurance premiums. So we partnered with Swan Bitcoin to establish and really create that opportunity for our members. And that went live in October. So we've had members stacking sats at a good time, right? The price is down of Bitcoin. And that's something that our members understand too, right? So we're keeping that fiat, then the 25% each month in fiat to be able to continue to fund crowdfunding and health events. But it is in the realm of possibility that you could either need to put in more fiat or sell some Bitcoin in order to fund a health event. So far, that hasn't been the case. And we'll see. I think the incentives now are aligned for individuals to take responsibility for their health, right? Ultimately, the bill's in your name. We're not health insurance. But there are a lot of tools that we can use, even bring in attorneys if need be, right? To make sure you're getting a fair price and make sure that bill isn't wrong. 80% of healthcare bills are wrong.
Yeah, this was the most flabbergasting aspect of what you guys have been kind of portraying with, when you're evaluating your members' bills. I saw a few examples that you actually presented at Adopting Bitcoin. Some member had a health condition. Her bill was like, I don't know, $70,000. And I think like 70% of the original price was shaved off after you guys observed the bill and had some kind of negotiation. I think I saw a statistic, correct me if I'm wrong. I've seen some members, almost 70% of the bill can go down. And then on average, it's like around like 40% of the original bill goes down. And then, you have the member paying a portion, and then the community, the crowd fund is essentially helping with that. So I'm interested in how are you guys negotiating? And the fact that most Americans are paying an enormous amount of money for erroneous, things on the bill. It's just, that blows my mind.
Yeah, it's wild. So for bills over $1,000, we're getting over 70% off.
That's crazy
pricing. And even for labs, instead of being $700, they're $40. For colonoscopies, instead of $3,500, it's $800. So there's all these procedures, and a lot of providers out there that are coming up and offering cash prices. And here's a fair price for a healthcare service. So the Oklahoma Surgery Center is a big one that has been listing cash prices and actually accepting Bitcoin for a while now.
Really?
Yeah.
Wow.
And other providers that'll actually show and there are price transparency laws that have come out in the last couple of years, but providers are relatively slow to be posting a lot of that information. And so there's just a lot of arbitrage, I guess, or just value that's wasted going into the insurance system, which is sort of artificially propping up prices. But when you get to the core of what you actually need, we can get that care that we need. You don't need insurance. What you need is healthcare, and you don't want to get stuck with a ton of debt. But oftentimes Americans are getting stuck with this debt because they show up in the emergency room and their anesthesiologist is contracted by that hospital and is technically out of network, and you're unconscious and you're stuck with that bill that was negotiated before by your insurance company. And now we can say, hey, what was the fair price for those services that the anesthesiologist provided?
Because they're uninsured. The member is uninsured. If
Yeah.
you are insured, you're not able to negotiate.
You've given up your agency to negotiate to your health insurance
What's the
company.
point of health insurance?
It's a great question.
Man,
And that's why at CrowdHealth, we're really providing all the tools you need to experience healthcare freedom. And my wife and I, we're delightfully uninsured.
Yeah.
And to some people, it sounds like, oh, this is super risky. But when you unpeel it, you realize that there's a lot that you can do as an individual, first of all, to take care of your health. That whether it's what you're eating, how you're moving throughout the day, sunlight, doing yoga or meditating, all these decisions we make on a day in, day out basis. If we live in this very high time preference and stressful society, you might think, oh yeah, I just want someone else to take care of that. But when you shift to a lower time preference and thinking more to the future, well, now we're storing our future healthcare needs in Bitcoin for that value to pay the provider, instead of paying tens of thousands of dollars a year just in case you get get hit by a bus tomorrow.
Yeah.
Which the odds of are also low. But of course, life is uncertain, right? There's always uncertainty. And the purpose of insurance is to technically pool that health and financial risk of the population, right, into one. But we're seeing that system and it just is breaking down. It's just not sustainable. Even the government, Medicare is supposed to run out of money in 5 years. What are we going to do about 65 plus? 10,000 people
Social
are turning.
Security as well. And
Yeah, it goes on and on. Yeah, it's all based on fiat. So right now we're accepting members up to 65 because once you're 65, you're on Medicare. But that might have to change in the future too for people that to be able to find a way to take care of our parents' generation.
Yeah, and all of the pool of healthcare's funds that they're receiving from, patients or people that are paying for that health insurance. I mean, it's a whole pool of fiat that's not. I don't know if health insurance companies are also partaking in the stock market.
They're investing that money.
They are.
Yeah.
So into funds to fight inflation. I mean, they kind of have to. At this point.
They kind of have to, but then they get the upside of any of that investment that's gone up. Yeah, because they're pooling the money that you've paid in. So for us, it's your money. It's not pooled. It's in an account in your name, right? We're helping to facilitate crowdfunding, but the Bitcoin is yours. And if you're to leave CrowdHealth, there's a small closing fee. Otherwise, you take that money with you. That Bitcoin is that appreciation of now this investment and understanding of Bitcoin is also yours.
Yeah.
It's not ours.
Let me get this straight. So these healthcare companies are taking in all of these premium payments. They're storing them into some kind of index mutual fund, and any appreciation they collect, they don't put towards, they're not putting it towards medical bills or to help the health insurance members?
So again, insurance companies can only make a 15% profit. Right. So for every 100 in premiums, they have to spend 85 in claims.
Right.
So that 15 is the profit and administrative cost. So usually the margins are actually pretty tight and it's difficult. So they will try to get any extra yield or earnings or cost savings that they can, right? Sometimes.
Oh my God.
Yeah. So and if you look at, United Healthcare is the seventh biggest company in the world by revenue. They made $80 billion in revenue last quarter, $5 billion in profit. And they bought the pharmacy benefits manager. They bought the provider. So they're becoming more and more vertically integrated, essentially negotiating with themselves for a lot of these services that, we partner, with Medalist RX, and it's saying, okay, you can get low cost medications, generic medications, right? But oftentimes if you go to the pharmacy and you are insured, they actually have a gag order. They can't tell you what the cash price is or the discount wholesale price is through GoodRx, through Medalist RX, even Mark Cuban's initiative. So there are pharmacy products now being developed out there, but you're not going to see them in a traditional insurance model because they're still using this very complicated pharmacy benefits manager system with rebates, and we don't have to get into all of that. That's just to say there's all these middlemen in healthcare, and now we're trying to connect individuals, whether it's through telemedicine, 24/7 access to primary care, urgent care, and talk therapy, working with a care advocate to help you navigate your healthcare journey. You're not going to be calling into, have a call center in India. Someone doesn't know who you are.
Right.
And you're just another number. And you'll actually develop a relationship and have a positive healthcare experience. And I think that's what's lacking in the industry today is it's not a good experience. Most people think of healthcare, and you can probably think about it for yourself or a loved one. It's incredibly difficult to navigate. It's incredibly complicated, and it just doesn't have to be that way.
Well, that's what we used to have. We used to have this kind of family relationship with your doctor. Your doctor would come to your house, while your son, your daughter, your wife, or whoever, the father, was sitting in bed and sick, and that doctor would come to the house and, develop a personal relationship. And it seems like ever since the Industrial Revolution, we've kind of created this, we've evolved our kitchens and our hospitals into a factory-like setting. I was listening to an episode of Joe Rogan with Brigham Bueller. I'm not sure if I've mentioned him to you. I've mentioned him to a couple other people. He's doing something, he's changing his model in a way it's not similar to you guys, but it's avoiding all these middlemen. And he's able to construct, or he's able to give access to patients to blood panels and whatnot. But he was on the episode and he kind of went through the whole hierarchy of, Wall Street pressuring through shareholder earnings to these health insurance companies. And then these health insurance companies, there's like a top 5, I believe. That's what he stated. And they're pressuring pharmaceutical drug companies on drug rebates, which then there's representatives of those pharmaceutical companies that are essentially marketing to doctors, whining and dining them. He describes how, he literally says this though.
Yeah.
He was a representative of some, competitor of Viagra. And he made a killing because that drug sells pretty well with doctors. And testosterone is pretty low, as Texas Slim from the Beef Initiative has kind of described on his mission. And we can get into food later, but essentially these pharmaceutical representatives, they have a budget that the company supplies to them, and their pharmaceutical company pressure these drug reps to say, like, why aren't you using your wine and dine funds? Because essentially that's what they're pressuring doctors to accept their drugs and then, implement this in their practice with their patients. And that's not necessarily going to be the best fit for that patient. I mean, as I've experienced here in Austin, this whole revolution of personalized nutrition, personalized exercise plans, this whole comprehensive diagnostics, and I can give examples of places in Austin, but I mean, it's just that, as you mentioned before, there's a completely perverse incentive, and it does come from, our money system being corrupted. And yeah, it's wild to me. It's pretty wild.
No, definitely follow the money, follow the incentives. And I think some of that whining and dining maybe isn't as prevalent as it was, 20 years ago when he was talking about, but it's still out there. And, you still have people that, ultimately, are trying to, make more money to do the things in life they want to do and feed their family. But you're realizing that with fixed supply of 21 million Bitcoin, now all of a sudden we have a lower time preference. We show through proof of work too. It takes work to take care of yourself. You're saying you need to really show and prove to yourself and learn, here's the education that I need of, maybe the food I've been eating has been causing this inflammation or making me not feel well. So you just have, I think, this natural confluence of health, food, Bitcoin that is super fun for us to be a part of, and partnering with the Beef Initiative and heading up to Nashville tomorrow for the Micro Summit and U.S. Cattlemen's Association meeting as well, and connecting with ranchers who've also been getting screwed out of healthcare for a long time because these insurance plans are not designed to meet their needs. It's designed to meet bigger and bigger cities and more concentrated and centralized communities versus decentralized communities. So now we can decentralize healthcare, provide these different tools so that it can meet your needs, but still bring people together now in a distributed way through our app and through our community. That those are going to be people that are going to step up and say, yeah, I want to help a fellow Bitcoiner with their pregnancy and a Bitcoin baby or knee surgery or anything.
Yeah, it's amazing to see how interconnected this all is. I mean, you've got the Beef Initiative supporting ranchers who are supplying some of the most nutritious foods that can be available to society, which for me, like I've changed from, almost being fully carnivore. I eat a lot of meat, just like Andy describes when he's speaking with people. I'm not sure about you, but he eats a lot of meat too. And I've never felt better knowing that I'm getting meat directly from the rancher that, is locally here in Austin, KNC Cattle. Cole has been fantastic, working his ass off. He's connected through Texas Slim's Beef Initiative. And for any of the listeners that don't know this, it's essentially this network that, they're leveraging the Bitcoin network, but the Beef Initiative itself is a business that connects ranchers all across the United States. But I think Texas Slim is also looking to go to Australia and other countries as well, and try to make it aware to society that, a lot of aspects of our world are now over centralized. Our money system, healthcare, the big five healthcare companies, there's a monopoly on certain sectors of our economy and society. And when we have this like hyper-local decentralized system using Bitcoin, a decentralized protocol, money protocol that's censorship resistant, we can, implement that with these ranchers and they can kind of profit and build their business and then supply food in a way that, is following the guidelines of regenerative farming, which eliminates monocrop culture, which is, in my opinion, I mean, I'm not an expert on this, but it does seem to be a major contributor to most of the illnesses that we have here in America because most of their crops are
sprayed,
grains, corn. And so, seeing this interconnection of Bitcoin and these ranchers and the Beef Initiative and then now healthcare, it's phenomenal. It's really, it's truly, I went from in 2020 being pretty pessimistic, not knowing really much about Bitcoin at all. And then like getting to understand Bitcoin pretty intimately, but then now seeing how it's helping with healthcare and our food system, we're gonna win. We're gonna have a ripple effect on society, and it's starting here in Austin.
Yeah, I think Austin's a huge hub for that. What drew us, my wife and I, down here, because it's a very active community. You see people running, biking, practicing yoga, eating well, a lot of farm to table. You've got farmers markets year round. and it's all about market access, right? As Slim talks about, and being able to buy regeneratively raised beef, directly, even with Bitcoin, and getting sats back through Oshi. We've got all these opportunities now to connect to producers. I just got some natural wines from Peony Lane in Colorado, and with Ben. So appreciated that.
Oh, I think I saw
Delicious.
that on Twitter. Yeah,
that's on Oshi, and he's shipping all over. So got it in a few days. It was amazing.
I'm gonna have to hit him up then.
Yeah. So also non-sprayed wines,
pesticides. Yeah.
All that free, because you're seeing, I think, so many of the health issues in this country too, right? You've got 6 in 10 have a chronic condition. 40% of the country's obese, right? And you look at the changes since 1971 when we went off of the gold standard, and you have a centralization of big agriculture and big food, and food being labeled as food that's not really food. And it's addictive, right? And it's hard. And I get that. And people, and it's a struggle, I think, day in, day out, also from an affordability perspective of being able to get quality food,
right?
Because that's what's in the grocery store. So you see that U.S. healthcare spend, is 2 to 3 times more than any other country, right? It's $12,000 per capita annually, but our outcomes are getting worse, right? Even if you use life expectancy as an outcome, it's also went down 2 years, during the pandemic. So for a lot of reasons, and it's unfortunate because, and then even Aaron and I have traveled a lot in the last couple of years, and we can eat the food, even the gluten and dairy, and you go to Italy or you go to other places that it's actually real, right? It hasn't been as modified or processed as it is here, so that when in the US you're eating gluten, dairy, corn, soy, sugar, that's what's going to lead to a lot of the health issues that are developed over very long periods of time. And now you have a lot of solutions and innovation in the healthcare industry, and you see startups trying to help manage different conditions. But let's go upstream, right? Let's look, like, how can you live your life to avoid developing a chronic condition?
Yeah.
And of course, some pieces are genetic, but I think often now too much is being blamed on genetics. And I think it's important to understand too, your epigenetics. How do those genes get actually processed, right? Or how do they get turned on and off and in practice? And you can impact that, right? You can make an impact on kind of how your body responds to your environment and what you're putting in your body on a day-to-day basis.
Yeah.
So that's where I think from the wellness perspective too, we have such an opportunity, and there's a lot of great educators and entrepreneurs here in Austin across the country that are helping people understand these different pieces of it so that you can really take control of your health. Yeah. And then with CrowdHealth, look, yes, if something does come up, now we have a community for crowdfunding. We'll help negotiate the bill. You can go to any doctor you want, right? There's no more doctor networks. And we even have a lot of members, using alternative methods, right? Or even for pregnancies, a great example. We have over half of the pregnancies going on now are using a midwife, home birth, that wouldn't normally be eligible, or health insurance wouldn't pay for that claim, right? But it is eligible for crowdfunding.
Yeah, midwifing seems to be on the rise. At least I'm witnessing it within the Bitcoin community. I actually went to a satellite event in Miami when I was there for the Bitcoin 2022 conference, and Saifedean's wife actually gave a whole presentation on it. Yeah.
Nice.
And she described, some of the parts of the process use drugs that are not, as healthy for the mother, but also not for the baby. And so I can see why midwifing. I actually know someone here, just an acquaintance that I believe she also midwifed, and
it'll be a lower cost, probably a better outcome,
and healthier.
Yeah, and just more connected to nature, more rooted, more grounded. Than, in this, talk about really perverse incentives. So when I worked in Medicaid, one of the most troubling things that we saw was that the C-section rate in the US has also grown dramatically since the 70s. So it used to be around 3 or 4%, and now it's 30%. And so 30% of all births are using a C-section.
Okay.
And you start to ask why, right? It's a surgical intervention. It's a lot more difficult on the woman who's giving birth. in Medicaid, normally you'll see surgical rates lower because they're paid less than commercial insurance. So traditionally, commercial insurance is paying 250% more for the same exact procedure, the same exact hospital than the government pays for the same service in Medicare or Medicaid. But with Medicaid, in pregnancy and C-sections, you're getting paid 5 times more than vaginal delivery. So there's a lot of fraud, waste, and abuse within the system. We saw providers that were doing C-sections 70, 80, 90% of the time because they don't know any better. And they're saying this is what their doctor's telling them to do. So then they go get a C-section when it's clearly not necessary, but then they're going to get paid more. And it actually varies by state. And you have different states had different rates. So like Illinois, and it also is correlated with the number of OBs in each state. You saw New Mexico's rate was 20%, Illinois was 25%, and then Texas was 30%. And that just it continues to add cost and make outcomes worse for individuals. So seeing that was really eye-opening for me and troubling to just see the type of fraud, waste, and abuse going on in the system, but especially, within the Medicaid system. So they're getting, you saw comparable commercial C-section and Medicaid C-section due to the payment rates, actually.
Okay, yeah. So I would have guessed at first that I think maybe because the whole quote, good times creates weak people and bad times creates strong people. And I wasn't sure if maybe mothers just, because they have that alternative, they just pick that because they just can get zonked out and then just a little slice open. But there's also an incentive within the the health insurance.
Yeah, they're just sort of calling C-section quicker than maybe they did in the past, right? And there are some clinical needs, and it is an intervention that sometimes is necessary, right? But it's not 30% of the time necessary, right? We're humans for a very long time. We've been giving birth without C-sections, and of course, it can definitely save lives, and it's an amazing intervention that's a lot of the medical technologies really grow. It's innovated, right? And there is a lot of advancement, and even the U.S. is very much the testing ground for newer technologies, newer drugs, all these things, because the payment rates are higher. You kind of have this testing ground here that then ends up being used in other countries as well. But who's footing the bill is people in America, and that's coming out of your paycheck. Yeah. Instead of your wages increasing with productivity, that money's going towards health insurance premiums. Right. So as a startup too, startups in this country are small businesses up to 50 are not required to provide health insurance. Only about a third of companies are because it's expensive, right? But they need to attract talent. How are you going to get the people from the Googles and the Apples of the world to start a new business or to come to your startup if you're not going to give them a fancy benefit package? So instead of paying $600 a month for a premium for your employee, you can give them $250, $300 a month, save $3,000 to $4,000 a year. And now the employee can go and join CrowdHealth. So it's always an individual decision to make. Companies can't pay us directly because we're not insurance. So we don't get the tax benefits. We're not a high deductible health plan, right? But individuals can take that stipend that they should have had higher wages to begin with, right, and use it as they see fit. And that's kind of the empowering message is let people spend that value that will best take care of their health. And now as a startup, as a company, you can still help your employees and make sure that they're, living healthy and being productive for you, right? Ultimately, that's the goal. But not be so entwined in their health and not have to, health insurance and employment now, half the country gets their health insurance from their employer. Right. And it's a legacy of World War II. You had wage freezes.
Yeah, I think I remember you talking about this at your panel.
Yeah. Yeah, I mean, it's important to note because we have this haphazard system that came out of, very much the last turning, right, or last crisis mode when there were caps on wages. So companies started offering an alternative benefit.
So the entire government,
health insurance,
federal government put a price cap on all salaries and wages.
Yeah.
I don't think I've seen that ever occur obviously in our lifetime. But that's pretty wild to even think about that.
Yeah.
The Federal Reserve is just saying, you can't, raise to a certain extent your employees' salary or wages. That's across the board in the entire nation.
Yeah, I think those price controls, in any industry, and then especially on wages, you see that happening now. They're trying to have demand destruction and raise interest rates, and people get laid off, and it's the same business cycle getting shorter and more volatile. But unfortunately, in the 40s, in 1933, you couldn't hold gold anymore as a private citizen, right? But now, thank God for Bitcoin, or we have Bitcoin now that we can store our own wealth in 12 words in our head, travel around the world and connect with individuals and create, and just seeing the hope that it brings to communities where before they have no access to financial services or even access, to healthcare services, where this model could even, that could work internationally, right? We're not insurance. This could be, we could help other Bitcoiners or other individuals around the world, and eventually, be utilizing the Lightning Network, crowdfunding in that way, and then paying providers directly with Bitcoin, cutting out the 6 to 10% fee. But each individual, I think, has to make that decision for themselves, right? And there's a lot of noise out there, but the first thing people can do is just focus on themselves, right? Focus on their own health, understand the decisions that they're making day in, day out. And I think that decision for health, it's interesting because it's, at least from health insurance perspective, is normally made once a year, right? You have this open enrollment period, which is right now, where the Obamacare individual marketplace that was set into motion during the Affordable Care Act last decade, 15 million Americans are buying a marketplace plan, and many Americans are getting their annual employer decision. And then it's sort of set it and forget it. Oh, I'm covered. All this money's going into insurance. I'm not really going to use it. And then my premium goes up 15 to 20% the next year, right? And that just continues year in, year out. And you look at the chart, it's just up and to the right for all of these premiums and just the cost of health insurance. So it takes an individual's personal decision to say, I'm going to take responsibility for my health. I'm ultimately going to bear that risk, but I'm going to be a part of a community and have these tools and actually get a fair price. So I won't get screwed. The likelihood of me getting screwed is very low. And just like if you're holding Bitcoin instead of holding dollars, you're opting out. You don't need a bank. You're opting out of that health insurance system. And now you probably will think more on a day-to-day basis. Just like starting to hold Bitcoin, you start thinking about your spending habits. When you join CrowdHealth, you'll start thinking about your healthcare habits.
So that kind of leads into my next question to kind of, you mentioned the generosity score. And for Bitcoiners that are pretty private, because most of the industry, it's privacy focused. I was wondering is there an option to be like synonymous in your community?
Yeah, because of PHI, patient health information regulation, you don't know who the other individual is.
Nice.
So we're trying to build a community still with keeping that privacy. So you only see what state the person's in, what the need is, and what their generosity score is. So you're not seeing what someone's name is. But we'd love to introduce more way to thank people, right? And create that community, because in reality, someone else has helped pay your medical bill. So being able to thank people and create that type of community is important for us, but also, of course, so from a privacy perspective, patient health information is very important for anyone dealing in healthcare.
Yeah, and I think it's also good to, me personally, I would like to know the people that are in it. Like get to establish a relationship, and it truly does incentivize the people that are, the members that are a part of your community, your crowdfunding community, to challenge them, right? Like the way that I would look at it is like if people in the CrowdHealth community that you're in opt in to reveal their information, you could have almost like a social media group that kind of incentivizes everybody to try new things or improve on their health in different ways and share information on cutting edge health and wellness technology and stuff like that. And let's say you do have a community member out of, I don't know what's the average size of your community members or communities in general?
Yeah, so right now we've got over 2,000 members in CrowdHealth. And about a quarter of them are Bitcoiners.
Oh,
So
wow.
we've really seen the Bitcoin crowd grow, particularly throughout the year since we launched it in June.
Okay.
And when people aren't making healthcare decisions, but maybe now leaving their fiat job and starting something entrepreneurial, or just making that decision to go from uninsured to go to CrowdHealth, seeing a huge uptick in Bitcoiners. So our average age is about 33, BMI 4 points below national average.
Okay.
So,
But it's all one big pool for right now?
right now it's one crowd.
Okay. Okay.
Once we get to probably around 1,000 Bitcoiners, we'll split it off, and the Bitcoiners will just be helping out other Bitcoiners
Cool.
with their healthcare needs.
Oh, nice.
And then if we can get 1,000 trainers or 1,000 realtors or 1,000 other communities that we've been reaching out to and partnering with to try to find gig workers, the Uber and Lyft drivers out there that also aren't getting health insurance. So that's where you create exactly what you're saying, like these affinity groups where people are more inclined to want to help each other
Right.
as well, because they're living a similar lifestyle.
Gotcha. Yeah, I was thinking almost maybe even small, because I can see, you guys are still technically like a startup and growing right now. So I was almost thinking of even smaller groups of communities. And one question I had in mind was, what if someone's just, they had a good track record and then they fell off the deep end and they start drinking a ton and they start smoking cigarettes and they start eating terribly. And so then all their, and then their family follows through with that over the course of the years. And, a majority of the funds in this specific community's crowd fund are just going to this one irresponsible person. But it seems like that wouldn't really happen right now because it's mainly just, 1,000 or 2,000. It's not like small little pools quite yet.
No. And, the individual is responsible to pay the first $500 of a health event. So that's in there too, to try to reduce some of the moral hazard that you get in traditional insurance, where because people have others that will help them, they think, they want to dump their health debt onto others. So we're trying to limit that as much as possible.
Yeah.
So you can't be over 260 pounds. You can't be a smoker. And
even like previously too, smoker.
Yeah, that's the policy right now. We'll see if that shifts. But that is if you had smoked for a significant amount of time.
Yeah.
That's a disqualifier on sign up. And if you had a condition previously treated or diagnosed in the last 5 years, you can't get crowdfunding for that condition in the first 2 years. Okay. And after that, you can get up to $25,000 a year in crowdfunding for that condition. So there is a way to kind of scale in, and maybe 10 to 15% of our members have other health insurance coverage right now. Maybe it's through their employer or kind of start the clock. But that's ultimately up to individuals. And we're here to try to be good stewards of the community and the funds that you're saving, and even potentially down the road, make it even more tangible where, hey, each month we'll see what we spend, and the rest is stack sats, and then make it more of like kind of a month to month journey for everyone, and create more of the community in that way, because now you're seeing the direct impact versus just the 75%. So we'll see kind of down the road. I think there's a lot of ways that also Bitcoin can continue to just be a big part of what we're building at CrowdHealth, from accepting payments to paying docs directly in Bitcoin. And we just started, we put out the call for a Bitcoin Doctors Advisory Board, which is really fun. So we've been interacting with a lot of docs around the country who have various expertise and working in different specialties that are also frustrated with the current system. Because like you were saying before, you used to know your family doc, right, for a while, but that's been taken away through the fee-for-service incentive scheme in healthcare, and kind of this hyper efficiency focus, where then your doc only has 7 minutes to see you.
Right.
So you're not able to establish that relationship. So when you now know what the fair price of healthcare is going to be, or what an hour of your doc's time really costs, they can have time to spend with you and reconnect. And I think that have that value for value exchange in healthcare that used to be so prevalent for generations, that now isn't there, where most people our age, if you ask them who your doc is, I don't have a primary care doc that I go or talk to, right? Yeah, it's like you kind of figure it out. And if
Yeah.
you need a physical for something, you go find, and there's other providers out there.
Yeah.
And even direct primary care models, we complement really well. So DPC is this model where you pay a monthly subscription to a physician and you kind of have full-time access to them. Maybe it's $50 a month, $100 a month. But usually people pair that with another health insurance plan, because if something big happens, it's not like your primary care doc's gonna be able to help you, right? You still got to go to the ER. You still need that surgery and figure out a way to pay for it. So our members actually get an annual wellness visit up to $300 that is eligible for crowdfunding. And you could use that towards direct primary care, or you could use that towards functional medicine or primary care, OB-GYN or dentist. So you can use that preventative visit kind of however you see fit, and what's best for you. But I think these docs will really help us to understand the challenges also within different specialties. How can we increase Bitcoin adoption within the healthcare industry, and also help our members? Like if our member has a specific need in cardiology or in, even the dental space, or we need to talk to anesthesiologist or radiologist, we have this network of doctors that's willing to support our members because they know, hey, here are Bitcoiners or here are CrowdHealth members that have opted out of the traditional system and want to try to make this more sustainable for everyone involved, the individual and the provider.
Oh, it's beautiful. Beautiful. Yeah, I was just thinking too, there are more functional medicine facilities. I don't know if you've ever been like Kuya or Kuya's a big one. I remember the other ones. Alive and Well. There's a few others that I haven't been to, but they seem to encourage this. Kuya specifically, and I kind of want to get maybe an employee or a founder on the podcast, but they have like contrast therapy. So ice and sauna, which I love. I'm a huge proponent or advocate of icing, doing ice baths and sauna. They also have...
Agreed, totally. It's great.
They also have almost a full year I've been doing it. It's amazing. They also have like float tanks, and then they have like a cool little shop. But then upstairs they're doing like ketamine therapy, which I don't know much about, but it seems to be a new a new type of a strategy to help people, specifically like if they had PTSD from war, like a veteran that went to war and they had a pretty daunting mental illness. Ketamine seems to help. I don't know anything about it, but it's interesting that they're approaching it in this way. And I've heard like MDMA and psilocybin, which is still, I believe, almost across the board illegal in every single state. I think Oregon might be helping with that. But anyways, what I was going to say is that I want to do their world-class diagnostics, and it involves like a blood panel. They get your heritage, so your genetics. They do like a brain map. They test your nervous system out. They'll have like a psychological assessment. They do a bunch of stuff, and it's only like I think under $1,500. But the visit overall, like if you go on their website, I mean, I'm telling you, it's amazing. World-class it's just like they call it as world-class diagnostics, and they give you a pretty like a paragraph for each assessment that they conduct on you. It's amazing. It's really like they can look at your brain and see if there's any deficiencies or with certain things. And so I have Blue Cross with Unchained, right? And I'm not entirely sure if that would cover if Blue Cross would cover for that. So, and it's like this cutting edge stuff that I would like to try, but I'm just not sure if they would cover for that. But I mean, you guys with the crowdfunding, would that, if it's $1,500, like around $1,500, I would pay the first $500, and then, or would that be included?
Services like that probably wouldn't be eligible for crowdfunding. You could probably use your preventative towards that, because I see that more as optimization versus addressing a health event. I think that's where you get into somewhat of a gray area. Right. And we want to try to include more, chiropractors or acupuncturists or other, licensed therapists and other healing modalities to help people. But I think it's just important and more holistic medicine and integrative care. But I think that's where you draw the line somewhere around and I think to address like back pain, right?
Mm-hmm.
Instead of getting surgery, if you can go to a chiropractor and that's a health event and pay $500, great. Like that could be possible. But I think for a lot of what you're describing, and a lot of those services are out there and they're amazing, right? And you can learn a lot more about your health. And for people that are curious and want to learn more about their bodies, now all the money that you're not spending on health insurance and all that savings, just use that cash and that value to go get the services that you need. So I think, it's really interesting to see how the health and wellness kind of field changes and people want to learn more about their bodies. Yeah. But one way we can help is definitely with labs, right? So now we're getting direct labs that cost $40 for a whole panel, or go check your testosterone or whatever else you want to check. And that's, all eligible for crowdfunding in your annual visit. Or if you want to do it more and more, it's again going to be the Quest and LabCorps of the world have commoditized this. It shouldn't be so expensive. But in your health insurance plan, it's going to be $700-800. Or in a hospital, it's going to be over $1,000 for the same blood draws and same information, because again, they have full captivity of what that pricing is going to be, building into all of these very complex models and risk adjustment. And, you have an incentive for people to actually be sicker, because for capitated insurance models, meaning you're getting like a Medicaid, you're getting a per member per month fee as an insurer to cover all of the healthcare needs of that individual. You get more money if the person has more diagnoses, basically. So there's a lot of like upcoding that goes on within the industry. And some of it's, we want to understand what are the comorbidities and what do people, how can we address these things? But also it's, a game in a way, right? And that's what fiat has turned it into, kind of this high time preference fiat game, reporting to quarterly shareholders instead of rooting us back in the ground, rooting us back in community.
Right.
We're separated from our neighbor. And now, even though CrowdHealth, we're distributed across all 50 states, just even in states where there's still an individual mandate for health insurance. So in states like California, Massachusetts, Vermont, Rhode Island, so where you're from, you'll have an annual tax for not having health insurance. But nationally, that was struck down in the federal courts a couple years ago. But we do have members in those states, and they'll still probably be paying less for CrowdHealth and paying the penalty than they will for just having health insurance.
Oh, man.
So make it up to individuals.
Yeah. Yeah. So move out of Massachusetts like me and Jose did.
Come to Texas.
I was just talking to my parents too over the holidays. And they were just saying, they've told me that before. Massachusetts taxes you if you don't have health insurance. And something else just passed recently during the midterms. They tax even more on if you're going to sell your business and whatnot. And Massachusetts, the state of just taxing the hell out of you. Taxachusetts, baby.
That's good.
Taxachusetts. Man, I can't wait to tell them about this too, because I think this is something they would be interested in once they get a full grasp of what you're explaining and what Andy's been explaining and the entire system. And you're right, it is a sick care system.
Mm-hmm.
I mean, from the top to the bottom of the hierarchy of society. And I became really passionate about our food industry prior to getting into Bitcoin, like back in 2017. I read Fast Food Nation, I read Food Inc., and then I watched a documentary. I think I watched another documentary on Netflix called What the Health, and it's just showing this lady that and a few others that were just eating terribly. Just eating foods that did not appeal, to their specific biochemistry, to their body, and then taking medications to fight the symptoms of what she was eating, and then taking more medications to fight the symptoms of the other medications that she was taking. So they did was tweaked her nutrition plan. It took a little bit of intention and focus, and it's not easy after being in that kind of cycle for so long. But once you realize if it's, food is thy, what is it? Food is thy medicine or something like that. Or there's a quote but it really is. And so I think
Or
that
even as simple as drinking water.
drinking plenty of water.
Yeah.
It's not easy for sure. Like I think I was a relatively healthy person for most of my life, and my parents, always had food on the table, and they supply me with, whole foods. But eventually, most of society gets kind of swept with the middle of the grocery store, which is just like these, different food products that have, majority of them, 80% of the food products have corn and tons of sugar. That's a huge issue. And seed oils.
Yep.
Seed oils has been a big one.
It's huge for the Bitcoiners. And I think you realize when you open your eyes, it's not real food. It's industrial sludge.
Yeah,
it's used in your car. It shouldn't be going in your body.
Oh yeah, and it's super cheap though for people to use.
Yeah,
for cooking oil, and it's literally in everything, man. So like, people probably look at me like I'm crazy at this point, but almost every time I choose to eat something, I look at the ingredients. Like I'm an ingredients reading maxi. Like I look at everything. The same way.
You have to.
And I used to not really care though. Like I would say I would look at it and be like, all right, it's got mostly whole food ingredients, but if it had like rapeseed oil, sunflower oil, or whatever, canola oil, I would be like, whatever, that's fine. And now it's like,
not anymore. You learn.
And the thing is that sometimes it's, you go to have some meals with your family and you don't really know for sure.
Or you order in from that restaurant.
Right.
And more people using DoorDash or
Yeah.
Uber Eats and all these things. And yeah, the convenience is nice, but you don't know what's going into that food. So the more you can cook yourself and use coconut oil instead of canola oil.
Yeah.
Use olive oil. Like there's a reason Mediterraneans too. Like when you go around, it's just real food.
Yeah. Yeah. I mean, I specifically use beef tallow. Sometimes I'll use avocado oil, coconut oil, but I mean, it seems to me like, I've worked pretty hard to, it started off with like meditating and then fixing my diet. Specifically right now, I've made it so easy. I just order a quarter of a cow from K&C Cattle. I have a ton of meat in my freezer. I buy local eggs from, oh my God, what's the name? It's a local egg.
Local pastures or something?
Well, so the farmers, the chicken, livestock, you call them ranchers as well if they're raising? Yeah, ranchers. Short-tail Creek. Thank you, Jose. I buy like 6 dozen eggs. I mean, per month I'll buy, 10 dozen eggs. I eat a lot of eggs.
Yep, a lot of eggs, a lot of beef.
And I feel great. I know it sounds ridiculous because, I've got family members. I remember a while back and even friends like, yeah, I'm cutting out red meat and eggs. It's bad for your cholesterol. This is exactly what, if you go into the Fiat Standard and go to chapter whatever it is, Fiat life of
Fiat food, Fiat science.
Fiat science, Fiat academics.
Amazing.
It's just, and so I'd like to do some more investigating on, bad versus good cholesterol. Because I know having a high amount of LDL cholesterol is typically deemed as being unhealthy. But if you're eating a lot of meat, you usually have a lot of LDL.
Your brain needs cholesterol to function, right? So even all the statins that people get put on, as preventative, again, it's another drug being thrown that isn't really necessary. And Andy's talked about this a lot on the podcast that he's done. The whole cholesterol con, I think, is you do your own research and you realize it's really not that bad. And it's not. Actually, you need cholesterol in a lot of ways. So meat and eggs have been demonized in a way, but a lot of, even if it's going to be bad meat, well, it's from the 80% that's centralized in 4 major producers. So if you actually now shake your rancher's hand, get regeneratively raised beef from healthy soil, that's the natural processes that we're using for a long time.
Yeah, regenerative farming. And I could be wrong with the percentage here, but there's a huge proportion of society that has glyphosate in their in their system, which is a
Roundup
chemical from Roundup, and it's a major cause of cancer. I mean, we're finding out more about it, but I mean, it's terrible for you. And so I even when I go home, like I try to ignore it, but like even when I'm eating a steak or like chicken or lamb back home, I tell my family, I'm like, where'd you get this? And then usually it's like Costco or BJ's or whatever. And you just don't know who the farmer was. You don't know if they were spraying their fields with pesticides. You don't know what what they were feeding the livestock. And it makes a big difference on the quality of the meat. You are what you eat and what they eat, So
Absolutely.
I've been really intentional, and like moving out to Austin, it's been super easy to be able to kind of just find those resources. So they're all over the place, and to be able to just kind of have that on autopilot. I mean, it's great.
Yeah.
Fantastic.
I think you don't get that in a lot of other places, at least in this country. And having access to farmers markets year round, I think is huge. Coming from Chicago, where they're great in the summer, but just because of the weather, you can't produce all those foods year round. So anything you're eating is, probably going to be flown in from somewhere else. It's not going to be fresh. So, yeah, we really love the connection here that you can make in Texas, and having ranchers come here to the Bitcoin Commons and connecting with others has just been super fun.
Yeah.
And
I love it.
It's a lifestyle.
Oh, yeah.
Now you're eating, once you start eating all these cuts of meat that you didn't even know existed, you want to try more. It's like you're not just going to get the 4 major cuts that are in, in all the supermarket aisles, but you actually know where it's coming from. I think that's really powerful. And I've seen it in other places. I've close family, friends in Israel on a moshav, which is kind of a collective where there's still private ownership, but they come together as a community, and they have a dairy farm, and they're producing milk. And then they've even very much optimized it I've never seen healthier cows. And my friend Zivi, who runs it, says, this is 10-star hotel for the cows.
Yeah.
They're jumping around. Like, they're super healthy. They're eating really well.
That's awesome.
And they've even figured out like the mix of the food that's great for their health. Right. So even if there is still a way also, if you don't have the pasture raised, you can still feed them well. But if you're feeding them with industrial sludge too, or these cows are now 1,300, 1,400 pounds that wouldn't exist in nature.
Yeah.
Well, then that hormone or that stress that the cow experienced before getting killed is going to be, reflected in what you're eating. And then also in El Salvador, met some friends who also have a farm, and now are coming back to their family land for the first time in a while, that have cows and are also doing some dairy production and are very much pasture raised. And it's seeing the connections now in other countries too. You see the connection to the land. And there's a lot of land here in the US that has been developed into monoculture, one crop, and that impacts our health. And I think until people realize that that's what they're eating is impacting their health long term, or if certain culture or these decisions are being celebrated if they're unhealthy, like, look, we can take control, and everyone has a different body. So I empower individuals to understand their own body.
Right.
And then also use the value that you want to use towards your health, towards finding these different services to optimize and improve your health. You can spend that value there. And then you can store your value in Bitcoin instead of throwing away in premiums.
Yeah.
So I think it's really all connected. It's really cool to see those connections being made. And it's going to come from conversations like this and other individuals who are just waking up to this now. And we took a lot of things for granted, I think, growing up, and that this was the way of the world. And you're seeing it crumbling and shifting in different ways. We're very much, I think, in the crisis period. And, if you read The Fourth Turning or The Sovereign Individual, which were big parts of my Bitcoin journey, which were written in the late 90s and are unbelievably prescient around the type of world we'd be living in right now, going into 2023. And it's up to individuals to wake up. And now you can have your medical sovereignty back. And your provider can operate at the top of their license and not have to worry about what is or isn't going to be covered by insurance. And they say, hey, this is what I'm going to do. This is what the cost is going to be. Great. Now we know what the price of healthcare is going to be. What a concept, right? You have that you go and take your car into the shop, right? You know what the price is going to be. You get an estimate, right? That doesn't really exist in healthcare.
I just watched Safety with Andy.
Mm-hmm.
And he was running through like how I think he needed surgery. Safety needed surgery on his ankle. I think his daughter also, or his child needed stitches, and he would ask like the doctors, what is the price going to be? How much is this going to cost? And they would look at him like you're crazy. We don't know.
Yeah.
And then the health insurance companies didn't seem to really have clarity either.
The providers don't even understand the cost of production.
That's
that's a massive challenge. So yeah, the docs themselves are even working in the hospital. Like, you have no idea what this costs. You're just so far removed from that piece of it.
Mm-hmm.
And it's handled by billing. Or, we accidentally paid an extra $100 million in claims. So let's try to claw that back now. Like, this is what's happening in the industry. So when you don't understand the cost of production, it's not really, you're not going to understand your business.
Shake your rancher's hand, join CrowdHealth. That's what you should do in 2023. Speaking of 2023, I wanted to see and just ask, what's on the roadmap for CrowdHealth and you guys? Like, how you're going to evolve. You're making a lot of progress. I've watched you guys for a few months now. I think I came to an Austin Bitcoin Club event. I think it was a few months ago as well. Maybe even the first half of this year. And Andy made an announcement. So it's, and since then, since I've had eyes on CrowdHealth, I've seen like Natalie Brunell, Robert Breedlove, Saifedean, some big players in the Bitcoin scene join, and they're sponsoring. So, and I just have like a friend that that's joined as well, and so I'm very interested. I'm pretty confident I want to join as well, but I'm just curious as to as you see this growth. I'm sure you're making plans, and I'd love to see how this evolves. And I know you mentioned there's going to be a doctor advisory board.
Yeah. So developing out the Bitcoin Doctors Advisory Board, continuing to connect with Bitcoiners across the country.
Yes.
And hopefully then splitting off the Bitcoin crowd and having it be its own group within CrowdHealth, I think will be really cool.
Mm-hmm.
We're also going to be with some of the Bitcoiners you mentioned. We'll be having a happy hour over at Bitcoin Miami.
Oh, cool.
On that Thursday, May 18th. So if you're a CrowdHealth member, another reason to be a CrowdHealth member, come join us for a happy hour there. It should be really fun. And I think as we continue to scale and grow the business, it's going to look a little different from 0 to 2,000 members as we go from 2 to 4,000 to 10,000 and beyond. So I think still that the personal touch and having your care advocate work with you. But there's a lot of work being done on the tech stack, on the product side and operations to continue to streamline a lot of those processes. And from a Bitcoin perspective, I think it's going to be hopefully accepting payments.
Mm-hmm.
In Bitcoin, I think would be a natural next step. I mean, the whole business could be run on a Bitcoin standard. And I think as we move in that direction and as people get comfortable also holding their own keys, and kind of moving in that angle, there's a lot that we can do with our business model that would fit with Bitcoin well, and kind of more of a collaborative custody model eventually, which would be great. We're sitting here on the floor with Unchained, right? So that's always an option. But I think this next year, it's also connecting with more businesses, individuals that, it takes a few times to hear CrowdHealth and understand what we're doing to make the leap. Or to feel comfortable offering this to your people at your business. So I've had dozens and dozens of conversations with individuals, with businesses that are really interested, but maybe haven't pulled the trigger yet. So I think still going into next year, continuing to have those conversations, and each day that we move forward, I think even being more transparent and showing as much as possible around, hey, here's, we have a lot of great case studies out there in ways that we've helped our members, making that more available for individuals, providing more tools, continuing to evaluate which partners we have from a telemedicine perspective and access perspective, adding more docs in, it's not a network, but it's, hey, we love taking care of CrowdHealth members because they're paying in cash in the day of the service. So continuing to show that organic growth while at the same time, show why CrowdHealth is better than your employer-sponsored health insurance. I think it's very clear why it's better than being uninsured or better than, a marketplace plan where you're going to spend $10,000 before it even pays a dime. But continuing to demonstrate that in the market and being that free market option. So, for Bitcoiners, you can use the promo code Bitcoin, get the first 6 months at $99 a month. We love seeing the growth through the Bitcoin community, and I think that's going to continue to be a big part of CrowdHealth. While at the same time, the fitness community, other entrepreneurs, gig workers, and connecting with different local communities. So it's very much also an affiliate. If you give your friend your promo code, you get $100 per sign up that joins CrowdHealth. And I think that word of mouth, building trust, and you'll see that natural snowball effect. And what we're hoping that people have a great experience working with CrowdHealth. They'll tell their family and their friends. And now it truly is helping each other out, right? Shaking your hand, shaking your community member's hand and saying, I got your back.
Yeah.
And that's some of the biggest pushback is like, does this really work? Will people actually help pay my bills? We've been so trained in this individualistic society to have to take care of yourself.
Yeah.
Even being separated from family in a lot of ways. So it's such a different mindset shift that, no, there really are people that will help you that have already bought into our model and very clearly understanding that it isn't insurance in a traditional sense, but it's creating human connection to the point that, no, we don't want any of our community members to end up in medical debt or to have a horrible health outcome or not be able to access the care that they need. So ultimately, I think that's the message for 2023 and continuing to strengthen the community as well and hear from you all, what else you want to hear and continue to reach companies that may haven't hit their annual cycle yet, like the Unchaineds of the world, and just make it an option, right? It doesn't need to be. And when you're over 50 employees, you have to provide health insurance. So you still have to provide it, but you can provide an option. There's nothing wrong with that. So I'm excited and continue to grow the team.
Nice.
And, it's great being here in Austin, the Bitcoin Commons, and getting to hear others, what projects are being built and what you guys are doing at Unchained is awesome.
Yeah, man. I'm really happy that you guys are, you're working from the Bitcoin Commons. I really look forward to the evolution of the Bitcoin Commons too, because it's going to help with your mission and help with other Bitcoin focused missions. And I love that. It's like, honestly, I'm so hyped about how it's building and strengthening this community, and this community is creating networks and healing broken systems. It's beautiful to see, and it sounds kind of mushy here, but like I don't know, I love to see it. And going back to you saying how we're kind of in this individualistic point in time where we're just like all heads down kind of focus, at least from some of my observations and even my own experience, and getting back into this kind of community affiliated part of strengthening that community aspect of life here in the United States, here in maybe starting in Austin, starting in Texas, and then moving outwards towards the rest of the country and the world. I mean, that's something that I think needs to happen. And CrowdHealth is definitely, I love it. That's my favorite part is the community aspect and like how it's totally flipping the incentive structure.
Yeah, there's no incremental shift or policy change that's going to fix the current healthcare system.
Right. Yeah.
And it's been up and to the right for costs, and down for outcomes.
Yeah.
For a while, and the quality of care, and just people are doing their best, exactly for the positions that they're
Right.
in. No fault to the providers, and even people working in insurance or in pharma or in other areas. People like at an individual level, I think, are trying, but it's just this broader system that everyone's a part of that ultimately you're driven by incentives as a human being. So by building a parallel system for health that's very much built on the Bitcoin standard, I believe over time people will be drawn to that. And if they want to make the leap from their fiat job, they won't be held back because they don't have health insurance.
Right.
And just having...
That's a huge point. That's a huge point.
Yeah. So I was over at Pleb Lab today as well, and they're building and doing an amazing job here at the Commons. Different founders, startups are here, and other communities excited to check out Bitcoin Park.
Yeah.
And across the country, you see a lot of these local meetups, and that's some of the best times for me to meet and talk with individuals, because there's so many entrepreneurs, business owners that have faced this health insurance conundrum for years.
Right. What used to be back in during World War II, when you said salary caps were really preventing employees from wanting to join a company, and then they offered this bonus. Now this bonus has kind of created a cap on their freedom to want to maybe divulge into different, more creative lines of work, because they have a family. They want their insurance to cover them, and so maybe their company just has a really good, really good, after hearing or having this conversation. And I don't feel like there's any insurance company that's really good, but in their minds, in their mental models, they might think I can't leave this health insurance plan. And if I leave and I try to join this kind of somewhat risky Bitcoin focused startup, oh man, that sucks. But, CrowdHealth is there as an option to really help them with that. And once more and more people figure that out, they're going to be able to just follow certain lines of work where they're not just so reliant on the fact that their company is supplying that health insurance plan.
Yeah. And that goes into a lot of people's decision, and it's a fear-based mindset, and it's afraid of change or taking the leap, but also from understanding that it is hard to navigate the current system on your own.
Yeah.
And it is expensive when all you've heard is, you don't realize that you can negotiate directly, and it's a federal law that you can get a fair price.
Yeah.
So there are a lot of tools, opportunities for us to really leverage. You Never Pay the First Bill is a great book by Marshall Allen, who's talked a lot about ways that you can go up against kind of the healthcare system as an individual. And I think we really embody a lot of those messages. We're not the only ones doing this, right? But we're putting a system or kind of a structure in place that allows people to be delightfully uninsured.
Yeah. I love it. I think that's a good way to conclude. Jon, why don't you just tell people where they can find you, where they can find CrowdHealth, and anything else that you'd like to express before we conclude this episode.
Awesome. Well, thanks so much for having me, Shane. You can find CrowdHealth on social media at Join CrowdHealth, Instagram, Twitter. Go to joincrowdhealth.com. You can learn more about CrowdHealth's offering. Feel free to reach out to me anytime. On Twitter, I'm at the Bitcoin Yogi. See a lot of similarities between Bitcoin and yoga, which I'd say for the next conversation.
Yeah.
So I'd love to connect and talk with others about CrowdHealth, healthcare, Bitcoin, food, yoga, anything. So really appreciate the time and conversation. Looking forward to seeing you around the Commons.
Yeah, it was my pleasure, man. And I'll make sure to put all that in the show notes. And thank you, man.
Awesome.
Peace out, everybody.
Take care.